Well, my presentation dealt with buprenorphine, a molecule that is very important for the handle for treatment of pain treatment. However, we didn't only talk about this important molecule that has comparative advantages that are obvious, and but also we're talking about pathology and physiopathology of pain. We're talking about concepts such as opioid receptors. Without that understanding, it's very hard to decide which kind of treatment, specifically if you're using strong opioids, to take. So in that way, I think our presentation was not only focused on that medication, but in generally how to use correctly third stage opioids or strong opioids. I would call it a problem, but a sort of bias, because formation, even in students of medicine, they're not focusing on palliative care. They are still focusing, they're still having this sort of chip about curing, only the curative aspect of medicine, which is not enough nowadays. Nowadays, we are every time more aware of this transitional change in population. Population is getting older, and the kind of disease that they are suffering, and they will be suffering, and they will die of, has changed through time. This is what we call the epidemiological transition, in which 50 years ago, 40 years ago, people died younger of infectious diseases. Now there's a transition. Now people's getting older and they're not dying of infectious diseases. They're dying of chronic degenerative diseases and oncological diseases. And most of them will evolve to a stage in which they won't have curative options. So symptomatic control is every day being more important. And in that aspect, our healthcare system, in generally speaking, in Latin America, they're still focusing too much on the curative aspects. But slowly, we're making this shift. We're understanding this shift. We have to. It's a need, because the way healthcare systems are offered nowadays will not solve the problems that we will be facing in less than a generation time. In Europe, where the population is older, they have already understood. They have already understand this situation. They already have bigger and more general palliative care healthcare services. Now, our population, comparatively speaking, with the European, still a little bit younger. But we will be there in less than a generation time, and we will be facing the same problems. Now, as I said, symptom control is a very important aspect, and specifically at home, because palliative care is basically home care. Not only, of course, we also need hospitals and places to treat specific situations, but basically home care for palliative patients is at home, as I said. And healthcare systems in Latin America have to understand, and they're beginning to understand that, because it's not only good for the patient, giving them quality of life, best care at home, but also for the healthcare system that provides this attention, this kind of attention, because it's more cost efficient. It's much cheaper to have a patient well treated and controlled at home than to have this patient continuously going to the emergency ward, or to occupy a hospital bed. And that without considering the problems and the suffering that also family has with this situation, because this is not only a problem of the patient, it's also of its family. Well, as I previously said, I'm optimistic. I think changes will go on, and I don't know when, but we are on the right path. It's a matter of time, and it's a matter of the people who make these decisions realize the need and the benefits of this approach to patients in which we don't have curative options anymore.